All right, so this is a pretty sad story, but it's unfortunately a sign of the times right now. Oklahoma effectively bans gender affirming care for many trans adults. Now, this comes after Oklahoma instituted, and I'll put the exact date on screen, basically a complete and outright ban of all gender affirming care for minors. Even if it's parent approved, even if it's doctor approved, they're not allowed to prescribe HRT or puberty blockers or anything like that to, or any sort of gender affirming care really to minors, which seems absolutely crazy to me because, trans healthcare is just straight up healthcare. I mean, by every scientific measure, by every medical association that backs gender affirming care. And you have to jump through a tremendous number of hoops to get to the point that you're actually receiving puberty blockers or HRT as a minor, right? Like I said, you need to have parental approval. You need to have gone to like a psychiatrist for over 6 months, right? You need to have multiple referrals from psychiatrists, not just see one, but see multiple that corroborate that this is the right path forward. You need to take other sorts of steps before you get to that point, like, going with different names, different pronouns, different ways of dressing before you get to the point that you're ever doing any of that. And all the science is very clear that like it works, that like all of these are very safe drugs, that the regret rate for people going through transition is lower than the regret rate for people receiving knee surgeries, knee replacement surgeries, like much, much lower. The number of people that received LASIK eye surgery. There's a stronger association with depression and suicide and all those kind of things with getting laser eye surgery than there is with receiving gender affirming care. But putting that aside, this isn't even about the kids though. They're going as far as to find ways to limit adults going through and doing whatever they want with their body and engaging with their doctors and the healthcare system in the way that they so choose. As its sponsor, State Senator Ted Gallagher explained, the law merely determines the fiscal policy of Oklahoma to say whether the taxpayers will pay for gender affirming care. Accordingly, Gallagher has primarily pushed it as a bill prohibiting Medicare funding for gender transition procedures, and that part is true. SB 904 explicitly prohibits Medicare coverage of gender affirming care for all ages. However, unlike the 12 other states that have implemented similar restrictions on Medicaid, Senate Bill 904 goes much further, stipulating that no state property, facility, or building may be used to provide gender transition procedures regardless of whether the procedures are provided to a minor or an adult. As if that wasn't enough, it also vaguely states that public funds shall not be used, granted, paid, or distributed to any entity, organization, or individual for the provision or subsidy of any gender transition procedures. Finally, it makes it a misdemeanor for state employees to allow public funds to be used for gender affirming care, which carries up to 1 year of jail time and or a $500 fine. Taken together, these restrictions constitute an unprecedented assault on trans adults' access to gender affirming care. To understand why, it's worth examining each of the three provisions individually, starting with the ban on Medicaid coverage. As mentioned above, SB 904 bans Medicaid coverage of gender affirming care for all ages, and in Oklahoma, that's a big deal. According to federal data, 468,000 Oklahoman adults, nearly 15% of them all, are enrolled in Medicaid, the third highest adult enrollment rate among states that ban gender affirming care coverage after Kentucky and Louisiana. Which makes sense, right? Because Medicaid is a joint federal and state program that uses tax dollars from both of them to provide subsidized and reduced cost health care to those below a certain poverty line threshold. And Oklahoma is not known to be one of the most wealthy or smartest or really any good metric states in the union, so it makes sense that they're going to have one of the highest Medicaid enrollments. For trans Oklahomans, this rate may be even higher, which would make sense because like being trans is associated with being lower income, with being more impoverished. And there's arguably a number of different reasons for this. The first one that obviously comes to mind is that like many employers, whether they're going to be outright discriminatory towards trans people or not, there's a number of employers that would negatively look down on the fact that you're trans. There are certainly plenty of examples where you may have gotten the job, you may have been completely qualified for it, but the fact that you're trans and that the boss or the manager who does the hiring and decides upon all that stuff has a secret anti-trans bias and they don't want to like engage with you and don't want to have you in the workplace, that they will deny you the job. Certainly more examples of that than the opposite, where like they see your resume and you may not have gotten the job, but they see that you're trans and they're like, oh yeah, we have to get this person right. Maybe there are some counter examples of that happening, but I would imagine that there's far, far more examples of bias against you being trans in the workplace and hiring procedures than you being trans. In 2022, UCLA's Williams Institute estimated that 21.2% of transgender adults are enrolled in Medicaid, a rate 1.5 times higher than that of the general population. Assuming uniformity, this means that as many as 23% of Oklahoman trans adults may be reliant on Medicaid and, as a result of SB 904, are no longer able to access the gender affirming care they need. And like I said before, it's the same case for children, minors under the age of 18 as it is for adults, okay? Gender affirming care is just health care, okay? Basically, every statistic and every medical institution and every medical organization backs this up, okay? If you look at people who receive gender affirming care, their suicide rates go down. If you look at their quality of life, it goes up. By basically every statistic and measure that we would look at for other healthcare procedures, it's a positive thing. It works. It's literally just healthcare. And so the idea that this has become politicized and that we're going to restrict people from accessing this gender affirming care because of just general anti-trans bias is absolutely gross. This will literally mean that some Oklahoman people who otherwise wouldn't have committed suicide or attempted self-harm or had a higher quality of life are now going to have a lower quality of life or do self-harm or potentially commit suicide because they were denied access to gender affirming care through the implementation of this bill, because they were reliant on Medicaid for their healthcare coverage and they can't afford to go out of pocket and have these drugs mailed in from out of state to wherever they are. And that might even be illegal, right? I'll put it on screen, yes or no, if that is illegal, but I wouldn't be surprised if there's some provisions or other laws in place in the state that actually make that illegal to just import those drugs from another state or whatever, right? You may have your primary doctor in Tulsa, Oklahoma, but you have your gender affirming care HRT doctor in like Dallas, Texas or something, and they mail the drugs to you. That might not be allowed. Furthermore, 20% of working Oklahomans are employed by state or local governments, and now their insurance plans can no longer provide coverage for gender affirming care either. So it's not even just those on Medicaid, right, reliant on taxpayer assistance for their healthcare coverage, right? It's also gainfully employed people contributing to the society that happen to be either working for the government or government contractors, and their healthcare coverage is pooled together and their insurance plans are pooled together with all their other employees and coworkers and whatnot, that they are going to be denied access to gender affirming care, even adults, which is just completely bonkers, okay? You know how restrictive insurance companies are, right? They don't want to pay out anything unless they have to, right? They will only cover like actual healthcare procedures that are proven to work. And even then you have to jump through usually a ton of hoops to actually get approved for that sort of thing. It's not like they're just handing out HRT or boob job surgeries or whatever like candy, okay? There's a long process that you have to go through to get these things. And the idea that just because you happen to work for the government or a government contractor or something affiliated with the government and you get your insurance pooled through them, that your insurance is no longer going to offer the health care that you need, right, is absolutely ridiculous. Just think of like a different disease or whatever, right? Like if you had diabetes or something, like if there was this big anti-diabetes push or whatever because, oh, you only got diabetes because you weren't healthy and you ate too many sugary things or whatever, even though that's not how diabetes is always given or always acquired. And therefore we're going to stop providing Medicaid support for diabetes medication and treatments and whatnot for those on government assistance. It's not even just that, right? It's for gainfully employed contributing members of society, right? I'm not saying that like those on Medicaid aren't contributing members of society, but I think you understand what I mean, right? That this isn't even like they're going past saying that the government isn't going to support this at all. We're now going to restrict insurance programs and truly get between you and your doctor. And this will have negative consequences. Like I said, there's going to be more people that have a lower quality of life that have to go way out of their way to, even if they can't afford these drugs, to try and illegally smuggle them in or have them imported in legally. I'm not sure which one exactly. Have to go see another doctor in another place to pay for that, have to travel for that, or potentially go without entirely and be subject to a lower quality of life, potentially self-harm, and potentially even suicide. On top of that, an additional 5% of the state's workforce is employed by the federal government, which cut gender-affirming care from its insurance plans earlier this year. And another 8% of Oklahomans get their health care through ACA individual plans, state-subsidized plans that are also subject to SB 904's new restrictions on gender-affirming care. Now, even though ACA, the Affordable Care Act, which is colloquially called Obamacare, is like a federal program, because it is like a jointly funded, it uses both federal dollars and state dollars together to actually fully fund the program. The states have a decent amount of say over how these programs are administrated. And so they're able to put this kind of restriction on an ACA plan as well. Even for those who aren't affected by these cuts, the story doesn't end there. SB 904 bars state property from being used to provide gender-affirming care. This provision almost immediately forced the University of Oklahoma's health system, OU Health, to stop offering this care. The impact of this is undoubtedly significant. OU Health is the largest healthcare system in the state, and it employs over 1,300 physicians, nearly 27% of the state's total 4,868 doctors or physicians. OSU Health, which has been similarly affected, employs another 2.5% of the state's physicians. Yeah, there's so many healthcare programs that are like sort of jointly funded, or maybe like they get special like subsidies from the city that they're in or from the state to offer reduced cost healthcare to the citizens of that city or that county or whatever it may be. This rule is going to apply to them as well. So this net captures a tremendous amount of Oklahomans, and specifically in this case, trans Oklahomans. As such, this provision means that almost 30% of the state's doctors are no longer legally allowed to provide gender affirming care, something that alone would undoubtedly strain the already dwindling number of providers of that care in the state. Now, you may think, oh, why couldn't these doctors go like on the side and create their own trans healthcare clinics that, maybe they work for OU, they work for the state technically, but then they have the side hustle that they do, right? Maybe in some circumstances they'd be able to do that, and that's actually not a bad idea. But I'm pretty sure that in most circumstances they sign in their contract of employment, they agree to only work for this employer, and that they're not going to basically do this sort of a side hustle thing, and that they could lose their employment for that, doing that sort of thing. So even if you are like a trans supporting, science following physician that wants to buck against the system and offer free pro bono care to trans people whose care has been cut because they were part of the OU health system or Medicaid or whatever, you literally might not be legally allowed to. But it somehow gets even worse. SB 904 also includes a ban on public funds from going towards the provision or subsidy of any gender transition procedures, and this part is much more vague. Questions primarily center around the word subsidy, and because Gallagher never clarified this meaning, providers have been left to form their own interpretations. Does it include only direct funding, or is it a provider that receives state funds technically using those funds to subsidize gender-affirming care if it requires those funds to stay financially afloat? We don't know the answer to that question, and like all vague anti-trans laws with criminal penalties, it leads to overcompliance. Any healthcare facility that may already potentially be struggling with funding and staying open and providing care to the patients that need it is going to err very much on the safe side legally and not want to provide any care that could potentially bring upon lawsuits or jeopardize their job individually on like a doctor individual perspective, but also like the well-being and existence of the clinic or healthcare facility as a whole. You saw the same thing with a lot of anti-abortion laws that have been implemented around the country post the overturning of Roe v. Wade in the Supreme Court, that a lot of these bills are fairly vaguely written, that like they aren't exactly clear on what types of abortions are or aren't allowed, or ones in the case of rape allowed, or ones in the case of like medical need are allowed, or ectopic pregnancies considered abortion, all these different kinds of things. And so you see examples of like women who are needing abortion because like the fetus is killing them from the inside because it's not a viable birth, but their healthcare providers are refusing, and they're making them wait until they get to a more medically dire position before they'll actually intervene and do the abortion, because they're worried that like if they do it too early, then it might be considered breaking the law because it's an unnecessary abortion and it's not like with the risk of the mother's life, and that there was maybe some outside chance that they could have had a stillbirth on their own, and yada yada. So this feels very similar to that. As an executive order issued by the state governor last year has already banned Planned Parenthood from receiving the state funds. So it's also hilarious. I'm just learning now that Oklahoma banned Planned Parenthood from receiving any kind of state funds, which doesn't surprise me at all, but it is also hilarious because like Planned Parenthood is the clinic that people who don't care about nuance associate most with abortions. And yes, that's certainly something that they do there, but they do a ton more than that. Okay, they provide mammograms, they provide childcare lessons, like how to raise a child if you are pregnant and planning to have it. They provide a ton of other services, and that abortion isn't even their main thing. So yeah, it's hilarious that like all of these other good things that they do for the community are swept up under the rug of Planned Parenthood. It does abortion bad. The state's Department of Corrections has interpreted the new law to prohibit it from allowing those in its custody to access gender-affirming care, going as far as saying that inmates arriving at an assessment and reception center who are received with hormone therapy prescriptions shall have that therapy discontinued, which is also horrible, okay? Because like whenever somebody comes into state or federal prison, they're required, and they're on a medication, say they're on like diabetes medication, or they're on low blood sugar medication or cholesterol medication or whatever it may be, right? The state or the federal government is required by law to continue that healthcare because they aren't able to access it themselves, obviously, because they're incarcerated and their rights are restricted. So it doesn't surprise me that they're going to do this thing considering all these other anti-trans bills that they've passed, but it's also horrible that you're just going to like, it's like you're not even acknowledging that this is a thing, right? It's like they're literally completely ignoring all of the medical associations and all the science that says like trans people are real, they're valid, and that gender affirming care works for both children and adults. But above all, Senate Bill 904 provides a roadmap for other states to follow in curtailing gender affirming care access for all ages, but also a roadmap for us to know what to expect and how to push back. As the Trump administration gears up to bar care centers that provide gender affirming care to minors from accepting Medicare and Medicaid, SB 904 offers an important window into how that ban and a hypothetical nationwide ban on care for at least some adults will likely be enforced. This sounds a little alarmist and might sound kind of extreme and crazy, but like I mean, we are very literally kind of inching our way to this point. And so like right now it may seem extreme, but in 10, 20, 30 years, it might not be surprising at all that they get to a point that a state like Oklahoma declares being trans like a mental illness officially. And then they institute mental institutions where they're allowed to literally like, if you're caught engaging in gender affirming care or you identify as trans or whatever, that they can institutionalize you and restrict your rights and your freedom and your liberty. And likely if they did that kind of thing, they would probably do a sort of mandatory cisgender conversion therapy in these kind of places, right? This sounds alarmist. This sounds extreme. And realistically, likely it will never get to that point. There's probably too many hurdles and that's probably too extreme. But hey, if they're passing this sort of a thing with a 2/3 vote, I mean, we're moving in that direction and it would not blow my mind if in 10, 20, 30 years we keep inching, and then we're at that point. So this is very anti-science, very anti-freedom, very anti-liberty. Trans healthcare is just healthcare. It's scientific. It's medical. There's a reason why basically all these medical associations come out and support it. There's a reason why statistics and basically every way that we would measure the quality and effectiveness of a healthcare procedure shows that they work. Okay, the regret rate for people who receive knee replacement surgeries or LASIK eye surgery is higher than gender affirming care. Okay, so. And these are not extreme drugs. We understand how these drugs work because we've been giving these same exact hormone replacement therapy drugs for 50, 60 plus years to people with various thyroid issues and various other kinds of diseases, right? People who aren't even trans, people who have testosterone deficiencies or estrogen deficiencies or whatever it may be. So yeah, I mean, it's not surprising in Oklahoma, of all places, the least educated state in the whole country and the whole union is doing this kind of thing, but it's really sad to see that so many Oklahomans are going to get swept up in this. And that like this kind of bill being passed will keep trans Oklahomans in the closet longer, right? They're going to be less willing to come out and identify as trans and seek the healthcare that they deserve, that they need, because they see what the society around them is doing and the potential social and political backlash that they're going to get for it. So yeah, this is sad and just very unscientific and disappointing.